Well, hi there, everybody. It's Dr. Steve with Kineci, and here is your understanding your pain. And today we're going to be talking about a knee strain or a sprain, but in particular the MCL or the medial collateral ligament. So those kinds of injuries often happen if you get hit from the side. Oh, a really common one, surprisingly common, is being at dog beach or the dog park and dogs kind of barreling into you as they're playing and you're not paying attention. And so very often that will be a blow to the outside of the knee, and it puts a stretch on the inside. And that's one of the common ways. Lots of sports, lots of things. Oh, very often slips and falls and stuff that you get into these precarious situations in the garage that you might strain as you're trying to get over something and pick something up, and there could be a tweak, a sprain. The MCL, so if we come up a little bit closer here, so the MCL, this is the model of the right knee. So sitting in here, this is the fibula on the side, the tibia, the shin bone, the patella here. But then this represents the MCL, the medial collateral ligament. And one of the things to appreciate about the MCL is it actually has some attachments, some fibers that connect to the meniscus. So very often when there's a MCL strain, we want to be careful of the meniscus. We want to be aware of what's going on, and vice versa. If there's a strain to the medial meniscus, we want to check out the MCL, and those things go together. So what we're going to be doing today is to get things moving, but we're going to be positioning stuff to not put a strain on the MCL. We're going to put a little bit more of a load into the outer part of the leg, the LCL, lateral collateral ligament, but we're going to be getting the knee moving. We're just going to do it in ways that we're going to minimize the strain to the MCL that we're saying is the injured part, and putting some load through other parts of the knee. So we're actually going to start with something called some half bridges and some bridges. And so we're going to pretend that it's my right leg that got injured, and we're going to start with a half bridge on this left. And so here you're laying down onto the ground, one leg is flat, one leg is bent up, and then you're pushing your foot into the ground as if you're going to be rolling over to the side. So this is a very safe position. You're on the ground, you're not going to fall anywhere, nothing bad is going to happen, but we're just starting to very gradually and gently start to ask the knee to do a little bit of work. So motion is lotion. We're getting things moving. We're getting stuff, creating some blood flow. We're going to do a bunch of half bridges on both sides. So then you would switch, and you're driving the foot into the surface to lift the hips as if we're going to be rolling over, but then the shoulders stay flat. And so it's creating this lengthening through the front. We're turning on some of the backside muscles, and it's a very gentle kind of motion to get the knee going. Now, building on this half bridge, I want to have you go into full bridges. And so the full bridge is where both knees are bent up. We're lifting the hips up and down, and I like these for the knee because it makes the knee have to work. However, again, it's in a protected position, meaning you're not going to fall, you're not going to slip or strain anything unexpectedly, and you have a lot of control over the motion. And so you can just kind of listen to the body parts and go according to what you can do. But then we're going to do motion in the three directions like we always do. So lifting the hips up, keeping them level. We're going to go side to side. I'll give you a little different view here in just a moment. We're going to do this side to side as if you're trying to keep the drink on your belly from spilling. And so shifting side to side, back down. If I give you this different view here, so from here, lifting up, trying to keep the pelvis level, and then you're shifting side to side with the hips and the pelvis. This asks the knees to do a bunch of work, but in a gentle fashion where they're having to control things. So after the side to side, you rest. Then we're going to lift up, and this time we're going to twist the pelvis back and forth. So here we're twisting, dropping one side towards the floor and then bringing it back up, but we're trying to really twist through the pelvis. And again, this is to help get the knee going, turning things on, putting it in a safe position, but starting to really stimulate some movement. And so there we have the first couple of things that we're going to do for your knee, for your MCL strain. Some half bridges and then some bridges. And be sure to tune in for part 2 and part 3, where then we're going to take it a little further, going to go a little bit deeper into some movements and some rehab direction. So if you or anybody that you know have been struggling with some knee pain, send them in, especially if it's a new, fresh injury. Don't just sit around and let things kind of get stiff and sore, but come on in for some help and let's figure it out and get you on a plan moving forward. So until next time, bye-bye everybody.